Hi, my name is Dr. James Maggio. I'm a chiropractor and I practice in Virginia Beach. I've been fortunate enough to be in practice since 1995, and one of the things that we see a lot of people have is a condition called sciatica. It's very confusing. People don't know what to do, so I'd like to show you one of the most common reasons why people actually get sciatic problems. When we look at someone's spine, normally the vertebrae should be very flexible and mobile. And as long as they're mobile, there's very little pressure on these. These are the sensitive nerves. But sometimes what can happen is those vertebrae can get stuck, and if that happens, it pinches the nerve. Once again, mobility, very little pressure on the spine, but if the vertebrae is stuck, it pinches the nerve. Let's look at this on a computer. If we look at this example, is if we see the vertebrae moving really well, very little pressure on the nerve, and the person feels good. But sometimes what can happen is those vertebrae can get stuck and put pressure on the nerve, and when that happens, wherever that nerve goes can cause pain. That's why people who have pinched nerves in their lower back could get pain in their back, numbness or tingling in their hips, pain in the knee, even numbness and tingling all the way down into the feet. Sometimes it can get so bad that it can affect the way they stand and they walk. We have a remarkable instrument called the Pro Adjuster. The Pro Adjuster is made by a company called Sense Technology. And what this instrument allows us to do is analyze via computer if the person has the joint stuck or if it's moving correctly. We take this, put it right on the spine, it elicits pressure into the joint to see if it's moving properly. And here's what's really cool. When we do that analysis with the patient, we can actually see what's going on, and the patient gets to see it as well. So when we analyze, if we see red bars like right here, that simply means the joint's stuck, and if that joint is stuck in the area where the nerve radiates down the leg, then we found the cause of their sciatica. After we do the analysis with the person, we can actually put this right back on the spot that's stuck, and it taps into the joint at a high speed, up to 90 times a second. And when we do that adjustment procedure, the computer will allow the instrument to run until the joint is moving better again. Once we see a restoration in motion, then the computer shuts it down. This is a computerized way of us doing chiropractic care. It's extremely safe, comfortable, computerized, and the results are outstanding. After we do the adjustment procedure, we can reanalyze the spine to make sure that those red bars are gone. And when we see the red bars gone, that means the pressure is off the nerve and the patient feels better. I want to thank you for taking time out of your schedule to watch this brief video on sciatica. And if you or someone you know has a sciatica problem, feel free to give us a call. We'll be more than happy to get them some information. Thank you and have a great day.